The treatment of hip osteoarthritis begins with a heavy dose of hip mobility and stretching. This is the hamstring stretch that there are multiple ways to do it. Lie on your back and pull your foot back with a belt or a sheet to feel the stretch in the back of your thigh. You can also do this stretch standing, depending upon your balance precautions. Hold all stretches 30 to 60 seconds, completing them 3 to 5 repetitions each. Another good stretch is for the hip flexor muscles, shown in the kneeling position. Lean forward at the hips. Make you feel the stretch in the front of the hip. Complete this stretch kneeling or lying on your stomach. Here is the alternate position. Placing something underneath your thigh, like a bolster, while doing the stretch, holding 30 to 60 seconds. Here's the butterfly stretch for the adductor muscle group. Push your knees down with your elbows to feel it on the inside of that thigh. Alternately, you can do this stretch standing and leaning in the opposite direction. You should feel it on the inside of that thigh. Again, 30 to 60 seconds. The IT band stretch shown here should be felt over the outside of the hip. Make sure to lean in the opposite direction of the stretched muscle, holding on to a stable surface. The piriformis is an important muscle to keep flexible, and you should feel that in the back of your hip as you pull your knee to the opposite shoulder. Alternately, you can do the stretch like this, again feeling it in the back of the hip. You should never experience any pain with stretching. The next stretch is the quadricep stretch. If you have poor standing balance, lie on your stomach and pull back on your ankle until you feel it on the front of your thigh. Alternately, hold on to a stable surface and pull back like this. You should feel the stretch on the front portion of your upper thigh. Now we can start on some exercises. First, we'll do the clamshell. All these exercises should be completed 3 sets of 10 repetitions. Again, no pain should be experienced. Put your feet together and lift that top leg up. Here is the reverse clamshell. Keep your feet together, lift that bottom leg up to the top leg again, repeating 1 to 3 sets of 10 repetitions. Now we'll try the ball squeeze, increasing the strength of the adductor muscle group. Find any size ball that can fit between your legs, like this, and give it a good squeeze, holding it about a count of 5. Make sure you count out loud when you're doing this exercise, so you do not hold your breath. Try the side bridge with the knees bent. It's a good way to strengthen up your core muscles. The core does an excellent job on supporting the body's movements. You can make this more challenging by holding at the top. The next exercise is a standard bridge. Make sure you push through your heels and lift your bottom up off the bed and squeeze your hips when you pull up. You can also make this exercise more challenging by crossing one leg over the other and then lifting again. This will help isolate that side of the leg. Let's try some 4-way hip. While lying on your back, perform a quad set by tightening your quad and straightening your knee out. Then, lift your leg about as high as your other knee and slowly return it back to the table, completing it 1 to 3 sets of 10 repetitions. Now we'll try some Jane Fondas where you're lying on your affected hip. First, perform that quad set again. Lift your leg up, hold it, then return it slowly to the table. This exercise is the same as the other two, but now you're lying on your stomach. Again, perform that quad set. Lift about 12 inches and then return your leg slowly to the table. Let's lie on the opposite side of your affected hip. Keeping in good alignment, perform that quad set one more time. Lift the leg about 12 to 18 inches off the table. You should feel the burn on this rainbow exercise, pushing through your heel into the wall and lifting your leg about 45 degrees. A favorite of mine here is the lateral walking with a piece of tubing or band. If you don't have a band, I suggest getting one because they are very versatile for your therapy needs. Try this one for about 60 seconds, feeling the burn on the outside of your hip.